Hello, everybody. Welcome. We are so excited to have you today for our CNO Corner webinar, Insourcing Dialysis in Critical Access Hospitals. Before we get started, a brief disclosure. The views and experiences shared by our guests today are their own and do not constitute claims, endorsements, or guarantees by Outset Medical. Individual results may vary, and nothing discussed in today should be interpreted as a promise or representation regarding our products or services. A couple of quick housekeeping notes. This session is being recorded and we will share the recording with all of the registrants afterwards. If you have any questions along the way, please drop them in the chat. We will do our best to get to as many as we can. Today's topic is a timely one. When your only outsourced dialysis vendor can't keep up, what do you do? Our guest, Valerie Austin, Chief Nursing Executive at Avem Health Partners, is going to walk us through how her team brought dialysis in-house across critical access hospitals in rural Oklahoma and why the leap was far less complicated than they expected. With that, I'll hand it over to you, Brittany, to kick things off. Take it away.
Thank you. Good afternoon, everyone. Like Ariel said, my name is Brittany McGill. I am the Chief Nursing Officer for Outset Medical. And this afternoon, I am so excited to introduce you to a peer and partner in the home state that I live in, Valerie Austin. And she is going to talk us through her bold and innovative leadership and how she led a team to do something that was truly remarkable in the best interest of the patients and the communities that she serves. So, good afternoon, Valerie.
Good afternoon. Thank you so much for having me. I'm so excited to be here.
Of course. Thanks for taking the time. So let's start with explaining a little bit about Avem Health, the relationship to those critical access hospitals, and then your role.
Yeah, absolutely. So I work for a company called Avem Health Partners. I've been here about a year and a half, and we are a hospital management company that helps to support critical access hospitals and make sure that we're continuing healthcare services in these rural communities, keeping the hospital doors open. And a large part of how we do that is our comprehensive swing bed program. So in rural areas, acute kind of inpatient census can be lower, but we have found a way to take post-acute swing bed patients, which is really exciting for me. My background is in emergency nursing. And when I worked at acute care facilities, there's oftentimes that you can't get a bed upstairs. And that's because the patients that are upstairs can't find a place to go. So we kind of fill that gap and take patients into our swing bed programs at kind of an elevated SNF level of care to both support our hospital census and to offload patients from the larger hospitals that have throughput problems. As I was getting started here, we take dialysis patients, of course, in these post-acute swing bed programs at each of our hospitals. And so the need was really there for a really strong dialysis program.
So let's talk about those three hospitals and where they're located in the proximity to the next major city.
Yeah, absolutely. So the first hospital is Rural Wellness Fairfax. They're up in Fairfax, Oklahoma, in kind of the Osage County, Pawnee area, which is kind of north central. I think the closest bigger town is Stillwater to that hospital. So they're kind of halfway almost between Stillwater and Tulsa, a little bit north. Our second hospital is Rural Wellness Stroud Hospital, and they are rapidly growing community about halfway between Oklahoma City and Tulsa, right in the middle of that turnpike. So have a really high volume of patients there. And then our third facility is on the opposite end of the state, down in southwestern Oklahoma. We support Rural Wellness Anadarko. And Anadarko actually has a very high volume of dialysis patients, a lot of end-stage renal disease in that community. And so dialysis is really critically important for that hospital as well.
Well, I applaud you because I know how important it is to keep patients in their communities. The literature and the research always supports keeping patients closer to home where their support systems are. And so I just applaud you and your team for doing whatever it takes to keep patients where they're familiar and where they can heal and thrive. And so let's unpack that a little bit. You were offering dialysis services at these three facilities and you found yourself having some challenges. You want to describe what those challenges were?
Yeah, absolutely. So in these three hospitals, we had a contracted vendor that provided dialysis services for us that we had partnered with. And over time, we found that there were some quality of care issues, and we didn't have kind of good control or have our arms around that. And then we started seeing issues with services kind of falling off where, treatments would be delayed. And in dialysis patients, that just can't happen. They'll get much sicker very quickly, and so we were concerned about the quality of care, concerned about the service availability. And like I said, started about a year and a half ago. Pretty much immediately got to looking around at kind of different options, and we really found that there weren't really any other options for outsourced vendors in the state of Oklahoma to provide dialysis services. There are some bigger companies that do outpatient services, but none of them were really willing to come to critical access hospitals. So we quickly realized that this is something that if we wanted to improve the quality of care and improve the access in these communities, it would be something that we would need to take on ourselves and insource. And so that's when we eventually reached out to you.
So that seems like an overwhelming project. You're in rural Oklahoma, resources are tight, and in those critical access places, a lot of nurses wear multiple hats. And so when you presented an option like this, can you just share like the response from your teams?
Absolutely. So yes, you're right. I often tell the nurses in these communities and anybody that I can talk to about rural health that the nurses really have to be like a jack of all trades
Yep.
and a master of all trades. They have to know it all and do it all in these communities. And it is by far not an easy place to work, and the competency level of these clinicians just has to be that much better because they're lower resourced places. And so as we started to investigate different options, we have a chief nursing officer at each of our hospitals, great nursing management teams, and our physicians and providers they're fantastic as well. And I'm telling you, it was an immediate, yes, let's do this. Let's get on board. Let's figure out how to make this work for ourselves. They had full belief in their clinicians at the hospitals, had full belief in making sure that we maintain those services for patients, and they were kind of all on board from day one, taking it. And I'm so happy to have that support because I think that's really what has made it turn out so well for us since we've
Yeah.
gone live.
You're lucky because that's not everybody's experience. Dialysis, if you don't do it, can be intimidating. And, I think as we were, preparing for this, what I heard from you and the team was the alternative was that you couldn't provide services and had to turn patients away. So, why not jump all in and figure out how to make sure that patients stay in that community and receive that care? And you guys owned it from beginning to end. Um,
Yeah, absolutely. I won't say it wasn't scary. I know had some fears myself. Dialysis is a specialty in itself. It is complex procedure. There's a lot that can go wrong, and when you haven't done it yourself and you haven't trained it, and really know, it can be scary. But as we started to look at partners and kind of got involved with Outset and with Tableau, we really found a level of support there that helped our nurses and our nursing leaders and our clinicians to feel more comfortable. I think it's all about the training, the hands-on experience, the at-the-elbow support that you get to make sure that your patients are safe as you kind of build that competence and that skill.
hmm I love to hear that because we are really big on relationships. No two customers or entities are the same, and you really have to listen and understand what the needs of those customers are, and then you provide a collaborative solution. So can you talk a little bit about, how we co-created the partnership and the training because it was really customized to you guys.
Yeah, I think it really was. And then we had some, kinks along the way and some emergencies that arose. So as we first started talking about insourcing the dialysis program, we were talking to our vendor, working on some quality issues and things like that. And at our hospital in Fairfax, Rural Wellness Fairfax, we had a dialysis patient that was admitted that they were caring for and just kind of abruptly pulled out of providing that service and said, we're no longer able to support you at Fairfax Hospital effective immediately. So we end up, transferring patients out, and then there's caps on census at our other hospitals. So while we thought we had a good long timeline to get everybody trained, all of a sudden, no, we don't. It's either we get it done or we don't have dialysis services. And so I feel like your team was very responsive to that. We had a project manager on our side. Jesse with Outset was the project manager on your side and really helped us to map out everything that needed to happen from, the online training modules to get comfortable with dialysis, to the in-person skills, to the vascular access training. I think that piece was one of the biggest kind of where we had the most fear is the vascular access component of it. And so offering that training, I think, really helped us to feel a lot more comfortable as well. And so, our original timeline, we're looking at going live in mid-August and doing it all three at once. And we ended up actually I think it was about 45 days sooner than we had expected. We started this process in March and April, and by June 3rd, we were up and running and live at Fairfax. So just the immediate kind of response to Fairfax, getting all the training done, partnering with that staff really went well. And then, 30 days later, we launched at Anadarko and we've gone live there. And they are, like I said, a really kind of high volume of end-stage renal disease patients in that community. And they're thriving with it. They're doing excellent work. And then on August 3rd, Stroud will go live, and that'll be our last hospital, and we'll be fully insourced at that point. So I'm super excited for that.
I know. I'm excited for you guys. Do you want to share a little bit about, the feedback from the two sites that have gone live?
Yeah, absolutely. I think that the training was something that they really did value. Like I said, there's some fear, and we did look at different options, that different types of machines and different things that we could use to insource this. And we found that Tableau to be very easy, very user friendly, easy to train on, and kind of easy to adopt. And so the machine part of it, the actual running of the dialysis and setting up the circuit and all those things, ended up being kind of the easier component versus the vascular access training. So we trained 6 nurses at each of our hospitals. We elected to go with an RN only model at first. Our previous vendor that we had used some technicians, and we had just some questions about their training and their competency and kind of skill level. And so we went higher to make sure that we did that right. So trained an all RN workforce. Ended up training about 6 nurses at each of our facilities. We have one nurse that's kind of primary for each facility that runs most of the treatments. It's kind of the expert. And then we hired in an excellent program manager who has a ton of outpatient experience, a little bit of inpatient experience, who's been a fantastic leader for the program as well, to help kind of coordinate all 3 sites to make sure that competencies are in place, and that as additional people on board, that we have a training program for them as well, to make sure that we can continue to offer the service, long into the future.
I hear that a lot, that there's an initial fear and trepidation, and then they get their hands on the device and realize all of the hard stop patient safety features. It will not let you pass go and induce harm to patients, which is really a differentiator. And so we get that feedback a lot, that it provides reassurance to clinicians that aren't as experienced in this space. And then we also hear it from experienced dialysis nurses that are like, wow, finally an innovation in this specialty. And that's exactly, what it's meant for. All of the different, segments of care, and that you've got one device that can be applied to various settings. And so, just like your leader came from the outpatient world, it's very easy to pick it up and use and lead an entire team.
Yeah, we found the equipment kind of knowledge deficit. So to get to competent with using the actual equipment was probably the easiest part of the journey. Our kind of trepidation came with the pathophysiology of nephrology patients and understanding what to look for a dialysis patient. How do you know that they're going south, and what are you seeing in their compensatory mechanisms, and if you do this, then you do this. And one of the things I think that really helped us with that was that Outset University provides that kind of introduction to dialysis for nurses that may not have done that before. And so that formed a really good basis of knowledge for the pathophysiology of kidney disease, kind of what's going on in the human body with renal disease and with dialysis, and kind of gave that good foundation. So that was some excellent education that I think hopefully really helped our clinicians feel more comfortable with what they're doing.
Yeah. Have you received any feedback from patients yet?
We have. We actually we had a patient that was up at our Fairfax facility that ended up having to transfer out for a different issue, go back to acute care. And when our clinical liaisons, they like to track patients that we send out to see if we can get them back. And he actually requested to come back to us, really valued the care. And we have gotten some great feedback from our patients in Anadarko as well. I think, when you insource, you have the ultimate kind of control over the quality of care that you deliver, the service and the hospitality. With contracted vendors, sometimes that's hard to manage. And so when we brought it in-house, we do have really high expectations and standards for our staff, and they have all lived up to it. They have all been gracious with the patients, and the patients are really happy with their care. And there were patients that were in Anadarko when we transitioned. So we had the vendor one day and then transitioned to taking that patient's care over ourselves. And they said heads and shoulders above what they had experienced before. They were really happy that we were doing it ourselves.
That's awesome. I love to hear that. So you spoke about some of the quality challenges that you had. Do you mind, just sharing with those that are listening, what specific quality metrics you're looking at and able to track now?
Yeah, absolutely. The platform for Tableau, there's kind of online access, which I love because our program manager, if he is not at the facility physically, he can still see every aspect of that treatment, how it's going, what the flow rates look like, what we're pulling off. So all of that is kind of real time available through the software and through networking. And so we are in the process of building out our quality scorecards now, but we're looking at timeliness of treatment. One of the things that we were experiencing is there would be delays in actually getting the patient started on dialysis. There were times whenever the contracted vendor would show up very late at night, and then the patient wouldn't sleep. And then they wouldn't participate in their therapy the next day. And at that post-acute level of care, that's very important to make sure that they're up, they're walking, they're having good sleep patterns and things like that. So we started to see that. We are looking at measuring, the percentage of treatment that is 100% compliant with the orders. So are we actually pulling off the fluid that the provider has ordered us to pull off of? How are the patients doing the next day? Are they more or less tired? And we're seeing some really good outcomes from what our patients are experiencing and how they're recovering from dialysis afterwards and how they're feeling.
Yep, that's one of the many benefits of the system is you're able to not only own the program, but you're able to use the data to manage it, which
Right.
is huge. Without that access, you're really flying blind from a leadership perspective. Let's talk about nephrology coverage. So you're in rural Oklahoma, you're in a critical access facility. How do you get a specialist to help?
We are very fortunate. We have a chief medical officer here that's very connected to the metro community and knows several physicians. And so as we looked at insourcing, we went with a telehealth model. There are three nephrologists. We have one for each hospital, and they're able to provide cross coverage, but they really do telenephrology services. Whenever we're looking at accepting a patient, we're looping them in so they can look at the treatment plans from the previous facility, make sure that they're appropriate. They're screening and giving us a yes. And so as we bring the patient in, that nephrologist calls in to the patient's room, via telehealth, evaluates the patient, consents the patient for treatment, kind of walks through the treatment plan with the patient, and then writes orders in our electronic health record, and then is available 24/7 if anything pops up. So we're finding really good success with the telenephrology coverage for sure.
That's awesome. So for those that are listening that feel a little overwhelmed about having to create, policies or procedures or competencies or order sets, what advice would you give them related to all of like the administrative operational paperwork?
Yeah, absolutely. I think that you guys were a huge help with that. There were a lot of policies that you kind of policy templates that you provided. And then, of course, we had a few in our system that had worked here that were previous dialysis nurses that helped to inform and make sure that we tailored those specifically to our patient population. But kind of out of the box, the policies and procedures that you provided were really great. The SOPs were very good. You helped us with developing order sets and making sure that all of that is accurate. So I feel like we had great help and great support to make sure that it went well from the beginning.
So as we, kind of wrap this up, what advice would you give to folks that are considering this or that are in your position that really want to challenge the status quo, but maybe a little on the fence about it?
I would say seriously consider this. Seriously look into it. It seems a lot bigger and a lot harder than it actually was when you get down to the meat of it. And in states like mine and in populations that we see in rural areas, it's such a need. There is a high need for dialysis treatments, for care of patients with end-stage renal disease. A lot of times these patients are going into, bigger tertiary acute facilities far away from their families, and then they can't get out because they can't access dialysis in their own community, or they can't be taken in post-acute because these services aren't offered. So I think that dialysis in post-acute care settings is a huge opportunity, both business-wise and patient care-wise. We're able to do it safely with high quality, and we're able to offload those patients from the tertiary facilities to help their throughput, and we're able to get census into our communities to support our hospital operations, and providing the best care for the patients that really need it. I would say, take the leap, really look into it. That's one of the first things I did when we started to consider this is I phoned a friend who had insourced with Tableau at a facility that she had worked at before. And my question was, what is your experience? Can we really do this? How heavy is the lift and how much support did you have? And she spoke very, very highly of the whole program and kind of gave me the confidence that we could do this. And then with the team's backing and the clinical support that we've had, our nurses are fantastic. They are willing to jump in and do anything to help their patients and keep a positive mindset about it. And our chief nursing officers were so supportive. That support of the team really matters. And I think it's easier to get that support from your team when you have really good, solid, training and education and policies and protocols for them to learn from.
Yeah, absolutely. I mean, the right team with the right attitude can do anything.
It can change the world, man.
Yeah, I just think like this is such an empowering story that you can take constraints and limited resources, but when you pull all the threads together, you can create something amazing like this. It's just, such a can-do positive story. So kudos to you, your team, your leadership. And I'm excited for you to launch your third facility and bring it home.
Yeah, me too. And then potential acquisitions in the future, looking long term, how can we expand this service
Yeah,
to benefit more patients, and kind of where is next? Of course, we want to stabilize what we're doing now and make sure that we're
right.
really good at it. But I do see opportunity in the future, for outpatient care delivery or for, partnering with long-term care organizations that are having to send their patients out, 3 times a week for treatment. There's potential opportunity there as well. So I'm really excited about where we're going.
Yeah, that's a great thing that we should really call out. I mean, if you find yourself without services and you have a population of patients that need to be served, like please reach out. We can help, connect dots or connect partnerships and we have the ability to be creative and innovative.
Yeah.
And you put the right minds together and a solution will emerge for sure. So just don't feel like you have to be stuck or backed into a corner because there is a solution out there. Just gotta.
Absolutely. There's another option for sure. Yeah.
Mhm. Well, thank you so much for taking the time, Valerie. We really appreciate all of your feedback and
Yeah.
success is in
I'm so
your.
happy to be here. I'm happy to have partnered with you all. And I'll tell the audience if there's anybody in a critical access hospital situation that may be considering this, reach out to Brittany. She has my contact information. I am more than happy to share our experience or to answer questions as to, how the process went along the way and what to expect. More than happy to do that.
Valerie, we just had a question come in that was asking, do your six nurses provide 24/7 coverage?
Yeah, so we have in the initial go live stage, we've capped the volume of dialysis patients that we have that we're taking. So we're taking 2 patients at each facility, 2 hemo and 2 peritoneal. And so peritoneal we had to insource as well and train on that, which is a little bit easier of a lift. So we cap it at 2 patients and we have 1 primary nurse at each site. We've trained 6, but we have 1 that is primary at each site. And so they're checked off fully competent. And so they are monitoring the other nurses and kind of bringing them in to make sure to validate their competencies and to make sure that they're comfortable before we set them loose on doing dialysis themselves. And so our treatments are scheduled. We don't do new starts yet. And so we also don't do, emergent or CRRT. So there's no real need for 24/7 call. It's always scheduled out. Which is really nice. And so we'll use those nurses. Typically, they're on a Monday, Wednesday, Friday. We're looking at a Tuesday, Thursday, Saturday option to kind of expand our opportunities there. But as we get trained, more and more staff that are validated as competent, then we'll kind of lift that cap and go from there.
There was another question about where do these nurses work when there aren't treatments?
They are cross-trained, so they can work on the floor. A lot of them are cross-trained to the ER and the floor, so taking patients and doing nursing assignments there. And then we have PRN nurses as well that provide dialysis support. So they may just not work, but if they want the hours, then they come in and take care of patients on the floor.
Yep. Perfect.
Great
That was
questions.
it from the chat. But that's the other beauty. When you own the program, you've got all kinds of operational and efficiency levers to pull,
Yeah,
which is
absolutely. We're very fortunate. We staff very well at our hospitals. We use a 4-to-1 ratio for our patients. We have a house supervisor that is out of patient care, but doing all those administrative duties and, making sure to teach and to train. And so those are typically our RN level is our house supervisor. And so those are the people that we really work to train to make sure that they're competent. And then, we have some dialysis experts, 1 at each facility. And several have had previous experience with Tableau as well, which was really nice to have as kind of our super users, dialysis educator type roles.
excellent. And we just had another comment that there's an organization interested in pursuing this service, and so they would love your contact, Valerie. So I'll get that over to this leader here. We'd
Yeah,
love to help.
absolutely. I'd love to talk more.
Perfect. Okay, thank you so much for the time again. And if we can help anybody be successful, we are more than happy to do so. So you all have a great rest of your day.
Absolutely. Thank you.
Thank you.